Good evening. Senior Care and Lifestyles welcomes you to join us tonight for a very, very special program. As you noticed in our title, we're going to be talking about mental illness. And I want to introduce you to Dr. Daniel Kaplan. He's going to be our expert resident psychologist for tonight. And I'd like to give you a little background about Dr. Kaplan. He's an assistant professor at the College of New Jersey and an adjunct professor at the College of Staten Island. He received his bachelor's degree in psychology with a minor in sociology, summa cum laude, from the College of Staten Island. He obtained his master's degree from Queens College in psychology and with a concentration in neuroscience. Recently completed his doctorate in clinical psychology from Walden University, and his dissertation examined the relationship between religiosity and substance use in the Jewish community. Dr. Kaplan has published several articles and book chapters on, am I saying it right, religiosity?
Religiosity, yes.
And spirituality, multiculturalism, and the advancement in the field of psychology through prescriptive authority. He is currently co-authoring a book on strategies to cope with anxiety and depression. So it is my pleasure to welcome Dr. Daniel Kaplan to the show.
Thank you very much. I'm happy to be here.
Yes, we have many issues, and I guess they're not new issues to you or mental health issues, you know, many, many, many years. So for those of us who are not in the mental health field, can you give us a definition of mental illness?
Sure. Mental illness, also referred to as a psychological disorder, is describing a person who has a disturbance in thoughts, emotions, or behavior. Oftentimes it has four characteristics, which we refer to as the 4 Ds. So the first is deviance. The behavior has to, in some way, be different than what is expected from in society, and that person's cultural norms. Distress is the second D. It has to be in some way bothersome to that person or the people around them. Then there's dysfunction. Dysfunction means that in some way it's affecting your life. For example, a student who has ADHD, when they're trying to study in the classroom, this could affect their ability to get good grades. Or if a person is in a romantic relationship and they have, let's say, bipolar, in this particular case, the emotional lability or the back and forth of emotions, that could affect their ability to function as well. And in some cases, the 4th D is danger. And danger reflects some kind of potential harm to oneself or others. So when a person is either suicidal or homicidal, that can occur. That 4th D doesn't occur in every disorder, but in some cases it's there, such as with severe depression.
Right. Thank you.
Sure.
Can you tell us what you do as a mental health, working in the mental health field? And I guess the bulk of the question is, what is the most familiar type of illnesses do you commonly see with the clients?
Sure. In general, psychologists are trained to do different things. Psychologists, the primary training is to provide psychotherapy. That is in individual form or group form. Another goal would be to administer testing. Now, testing is very important because it could be for intelligence purposes, personality, and with the older adult, sometimes things like dementia, Alzheimer's, it's very important to do something like neuropsychological testing. One last thing that we talk about is forensic testing. That is where a psychologist would apply the principles of psychology to the legal system. This could be competency to stand trial. This could be things like child placement testing and so forth. But me personally, so that's psychologists as a whole, my personal experience is pretty diverse. I have some, my first experience is at South Beach Psychiatric Center. It's right on the island here in Staten Island, and it's an inpatient facility. And there, the most common disorders that I had experience with were schizophrenia, bipolar disorder, suicide attempts due to depression, and in some cases, borderline personality disorder. Borderline personality disorder is a more global disorder, and in that case, the person has an unstable sense of self, and it affects their relationships pretty severe. Afterwards, and most of my training is actually outpatient, so I went to the Hamilton Madison House, and there the more common disorders are anxiety and depression. And what I think is interesting about that is that, and we're probably going to talk about a little bit later, the stigma piece. The vast majority of disorders that are diagnosed are non-psychotic, and the stigma comes from a misunderstanding that mental illness and psychosis are the same.
Yes.
Yeah.
Yes. That's why we're having this show, because we're going to clear all of those things up.
Sure.
So, with mental illness, it does have a stigma. No matter what anybody says, of course, depending on what the illness is. So I'm sure that you have come across this kind of discrimination while you're working. So what is the most common, should I say fear, or we'll stick to stigma? I think they're afraid. I think people are afraid.
Sure. I think fear or stigma both work. Stigma is where a person, because of what they bring to the table, they're afraid to be themselves. They're afraid to talk about what's going on. So they change their behaviors in a way to avoid discrimination. In my experience, I've seen people not be able to find housing. So if a person has a mental health concern, when they go to seek a house or an apartment, and they present a certain way, a person's like, I don't want to touch this one.
Right.
Right. Another example is in academia. Just this week, I read something in the New Yorker about a boy who was 20 years old, and he was at Princeton University, and he attempted suicide due to taking excessive amounts of pills. And the university said, you have to leave. They literally pushed him out of Princeton University. And that is part of the fear. The stigma is that if I disclose to you what I'm going through,
right. Am I going to be punished for it?
Yeah, exactly.
But I know it's a little bit off the list here,
Sure.
but so many students, when they get to college, go through this horrific change in life, change in lifestyle, and that schizophrenia, maybe that was all the way back there for so many years, comes to the surface.
Oh, yeah.
And I mean, I'm sure that, I don't know if anybody published the amount of students through the United States that attempt suicide.
Yes.
Am I on the right track?
You're entirely correct. Adolescence is a funny thing, and when we talk about the college student, most of them are 18 to 25, and they're asking the questions, who am I? What is my purpose in life? And there's a lot of pressure. Many of them are leaving home for the first time, and this stress that's associated with this can trigger any number of mental health concerns. Most commonly, anxiety and depression. Schizophrenia is also very common, or relatively common, but it all comes from this pressure, that stress.
Right.
So you're entirely correct.
Right. So I did mention that people are afraid of mental illness. And as a nursing background, I'm going to guess that they're afraid. We say people are afraid of what they don't understand.
That's correct.
And what can we do to fix that?
So just to pull back, I think you are correct. Most people, they have this fear of mental illness because they don't know enough about it. And the most recent estimate is that 1 in 4 adults suffer from a mental illness of one sort or another. And what I would try and do to do something about it is educate the public. And I just put some notes down here which are interesting, that some of the greatest minds of the current and past generations had mental illness. For example, Abraham Lincoln, the 16th president and perhaps one of the most influential members of the civil rights movement, suffered from severe depression where he wanted to commit suicide. Charles Darwin, noted evolutionary scientist, suffered from severe anxiety that he couldn't leave his home, where his stomach would bother him. Edgar Allan Poe, a noted writer, suffered from bipolar disorder. Robin Williams, which I wanted to bring it more current,
Yes.
Actor and comedian, one of the classics, one of my personal heroes, struggled from alcoholism and depression that led to him committing suicide. And the last one I noted was John Nash. And John Nash, they made a movie about him called A Beautiful Mind, and it's an award-winning movie about a Nobel Prize winner. He still is around. Speaking of Princeton University, he's still there. And he developed schizophrenia, and he taught himself how to come out of it. So talking to people about the great gifts that we have due to people with mental illness will go a long way in removing that fear, right? Because I think all of us have a family member, a friend, or someone around us that we know that struggles with mental illness.
Absolutely, especially when you say 1 out of 4. You know, my mind is clicking, and of course it's just part of us, you know, part of our population and part of human nature. We're not all made perfect. We're not cookie cutters. We're all individuals, and some of us are struggling.
Yeah, I would just say, just remember that that person could be your brother, your mother, your son, your daughter, and to have that level of compassion and recognize that in the end, people with mental illnesses are still people, and the same dignity and respect we would give another person, we need to have that at the forefront of our mind.
So education for the public.
Oh yeah, psychoeducation.
So do you think that there are more people with untreated mental illness in the community than we are aware of?
Yes, of course.
And why? Why?
So some of the reasons why people don't seek help are because they're either part of a marginalized group. For example, if you are an undocumented immigrant and you don't have health insurance, you may not be able to go and seek mental health therapy because you don't have the insurance. And at the Hamilton Madison House, it's a bicultural Asian center, and we have undocumented people come in, and they have the fear of, are you going to report me, right? Occasionally that happens, and we have to tell them that we're here to help you. We don't work for law enforcement. It's not that. But that's just one example of where a person may not seek services, and they may struggle with mental illness silently. A second example would be the traditional groups. So the more traditional groups, for example, I'm Orthodox Jewish, and there's anxiety about marrying our children off. And if we reveal that there's a mental health concern in the family, will people want to marry our children? So these are just two examples where mental health concerns go unnoticed and untreated.
Right. I can recall as a child growing up and visiting family and friends, and specifically an uncle and a cousin that one was Down syndrome, and one was brain damage through epilepsy.
Okay.
But I know that's not mental illness, but I'm just saying, along with people that did have problems with mental illness, they were kept at home.
That's right.
Years ago, the family kept them at home. They were not treated. They did not see a physician. They were not on medication, and the family just handled it themselves.
Yeah.
And you have that generation after generation thinking that that's the way to go.
Right, and that goes back to the point of stigma, which was what you were bringing up. Just to put things into perspective, the new DSM-5, which just came out in 2013, has nearly 300 disorders in it, of which only 1% of the people would be classified as having psychosis or a psychotic disorder. So that stigma, that fear, it goes a long way. People like to push people to the side. Let me not introduce you to this person.
Right.
Hide them in the house.
Yes.
That's problematic, because the stigma is that if my child has a mental illness, that means either they're crazy or nuts or whatever it is.
Right.
And unfortunately, 99 out of 100 cases of mental illness, they're non-psychotic in nature.
Right. That the fear is that they're going to be shunned,
That's right.
and so the family just protects them and keeps them
That's
in.
right. Mm-hmm.
But I know that goes on, but it was very prominent in my mind years ago. That's what they did.
Sure.
And I know they're still doing it today.
Yeah.
Okay. So, due to the stigma associated with mental illness, do you believe it takes people longer to get the help for the problems they're having?
Yes.
This falls right into that.
Yeah, there's no question in my mind that this is true. And I'd like to share 2 stories with you, if you don't
Sure.
mind.
No.
The first one is personal in nature, and it's about my son. And the second one is about a former client. So my son is diagnosed with pervasive developmental disorder, which means that he's on the autistic spectrum. And I remember when my son was about 18 months old, and he was nonverbal. He wasn't speaking. And I said, there's something up. And I started to observe his behavior more. And I saw he would walk on his toes. He would flap his hands. He would line up cars incessantly. And I'm like, I believe my son has autism.
Very specific.
So I talked to my mother-in-law at the time, who's a special education teacher. And I said, you know, Shalom might be on autistic spectrum. And she said to me,
No.
there's nothing wrong with my grandson. And had I listened to her, his services would have been delayed. But I spoke with my wife, and I said to her, I think there's something wrong. So we agreed to take him to Manhattan, have him evaluated, and sure enough, he's on the autistic spectrum. But today, because we did that, and because we disregarded that factor, he now is verbal. He can go to the playground. He can make friends. He can express his emotions. But that factor of having a relative say, there's nothing wrong, that's going to delay services.
And with that particular situation with autism, that is so common
Yes.
because you're looking at this very cute little baby boy, and you're just putting a curtain over the fact where there's no eye contact,
Yes.
or, oh, he's a boy, it takes them longer to speak.
Oh.
You know, everybody says that, but the sooner the better.
Yeah,
I mean,
and
that's the way I
I
look at
think
it.
that's a mistake. That's a classic mistake that people make is, oh, he's a boy, it's just going to take him longer.
Right, everybody says that.
That's a mistake. And if your child is 18 months or your grandchild is 18 months and nonverbal, start getting the hearing tested, go to your pediatrician, and then eventually rule out autism. So that's a personal case where it could have easily been delayed. The next case is a former client of mine who was diagnosed with schizophrenia, and she was in and out of the hospital, and one of the reasons was that she refused to take her medication. And this is very common, and I said to her, so-and-so, why don't you take your medication? Again, the stigma, right? She said, if I take my medication, that means I'm crazy. And sitting there and listening to that, my heart, it went out to her. And then I said, okay, so let's examine this. If you take your medicine, that means you're crazy. What happens when you don't take your medication? And she said, well, I stop associating with my friends, I stop eating, I start hallucinating, and then I wind up in a hospital. And I said, so you're crazy if you take your medicine, but you have hallucinations when you don't take your medication. So I had to challenge that false belief.
The process of thinking. Yeah.
Because that stigma she didn't want, and she could have lived, very talented middle-aged woman, designer, very creative. She could have lived a wonderful, functional life, but she lost, I would say, about 8 to 10 years of her life because she stopped taking her meds, and that's a problem.
I see it all the time. I see it more so with the younger people because they start to feel better and then they don't want to take the meds and they don't want their friends to see them taking the meds, and then it's a vicious cycle.
Sure.
They're in and out of the unit at South Beach.
That's right. It's heartbreaking.
Very sad. We only have a couple of minutes left. Okay. Causes of mental illness.
So what causes mental illness? I'll be brief. This is a real difficult question to answer because most people believe that there's one answer to this. So they're looking for, this is the cause of depression. In reality, there's a good several dozen answers, and they go along different lines, biological reasons, such as genetics, so certain disorders run in families, biochemical factors such as neurotransmitters, so depression and serotonin are linked. Psychological factors, just to move along, people who have negative view of oneself, the world, and their future are more likely to develop mental illness. Aaron Beck called that the cognitive triad. And environmental factors like poverty, stress, conflict in the home, all of these factors can come together. And if a person says, well, how does a person become mentally ill? My answer is, gosh, we need to study that person individually and see what happened in their life, because there are biological, psychological, and environmental factors at play.
Right. If it's not physical, then it has to be the other end.
That's right.
Okay. Is it difficult for people to accept their own mental illness when they're newly diagnosed?
Sure.
Because I'm sure that they don't really want to come through your door.
No. Coming to grips with any diagnosis is difficult. I know you're a nurse, so you deal with medical problems as well. But I would say mental illness and medical concerns are almost identical. And there's a great researcher, Kubler-Ross, who talks about a process of grieving. And grieving doesn't have to be death. It could be any traumatic experience.
Right.
So getting a new diagnosis, it comes with 5 stages. And in the hospital setting, you might hear the following. So denial's the first stage. I don't have a mental illness.
Right.
And that
You're wrong.
That you're wrong. I want a second opinion. I don't have a mental illness. Then they get angry. So anger is the second stage. They're like, you're holding me in the hospital against my will. I want to get out. It's unfair. Then they start bargaining. Right? And they say, all right, I will start taking my meds, but you have to work on getting me out of here. So they're negotiating. And then they get really depressed because the bargaining doesn't always work. Sometimes it takes time for the medication to kick in. So they just give up. Eventually, they come to acceptance and they say, all right, I have a mental illness. And when that happens, that's when they get better. And that process, it takes time. And almost all of my clients, I would say, when they came in, I said, well, what brings you in to treatment today?
Right.
The answers that they gave me, I found 6 months later, were the symptoms that they were comfortable saying. So even that, it's that difficulty coming to grips with a diagnosis.
Very difficult.
Yeah, sure.
And sometimes when we would see a teenager in the emergency room, and we know there's something wrong. We know that they need to have some psych treatments, and the mother or father, parents there, whatever, and the child is crying, no, I'm not going, and the parents are saying to us, no, we'll take her home. And you have to get to that point where it's not safe, they have to go. It's so difficult, and my heart was really bleeding for the child, but for the parents, they just, and the right thing is for the child to be on meds.
That's right.
Or to be seen, to get help. But the parents just don't want to face that diagnosis.
Right.
It's
tough, and that's the stigma factor.
Okay. Do you see a difference today in a wider variety of people coming to get help, like different levels of ages?
Sure. I would say that in in today's society, with technology, with instant access to answers to questions that have plagued us, people know a lot more about mental health concerns. And in the last 30 to 40 years, people are more likely to go see a psychologist. And my personal experience is I have seen people across the full age spectrum, as young as 6 years old, all the way to late adulthood, working on things like dementia, Alzheimer's, and things of that nature. I've had people with developmental disabilities or acquired disabilities. I'm starting to see people of all religious backgrounds coming in, all different financial backgrounds. This is interesting with the finances, that people think that money buys happiness, and money in some way can be a buffer against mental illness. It doesn't. And you could go through sexual orientation, immigrant status. So the field of mental health is developing. And even though we talked about stigma prior, it's slowly eroding. And I'm hopeful that in the future, mental health concerns will be better treated.
I feel the same way. I see, the doors opening a little bit more. We only have a minute left. Baby boomers, are they coming in large numbers?
Baby boomers are coming in. Baby boomers come in with three major concerns: anxiety, depression, and cognitive decline. And they're coming in. Just because we get older doesn't mean that we don't want to enjoy life. So yeah, they're coming in, and it's difficult.
Good. I thank you so much for coming to the show. It certainly was educational, enjoyable. Yes. I hope our audience takes a lot of good information away from tonight's show. Thank you, and good night.
Thank you.